Yeah, no, in the interest of time and clarity, I also won't speak with lots of slides or any slides, um, partly because I think so many of the right things have just been said, and I concur with so much, nearly everything of what I've just heard. So all I can do really is try and talk about our experience. I'm a professor of immunology who spent many decades looking at infection and immunity and autoimmunity in so many different diseases in so many different countries in the world. And we, in this context for today, we were, like Brendan, one of that kind of second tranche of NIHR award recipients, where our project was won really as kind of card-carrying immunologists and autoimmunity experts on mechanisms and diagnostics in long COVID. And when we kind of when we got all our ethics and things in line and started branding and rebranding, we decided to call ourselves the Wilco study so that we could be recognizable and sort of have some kind of self-explanatory badging, where Wilco was our clumsy acronym for working out the immunology of long COVID, because we wanted a kind of does what it says on the tin kind of title. And it runs adjacent to the work we've done really 7 days a week for more than 2 years now on the immunology of COVID infection and vaccination, using everything we could from the kind of high-tech molecular immunology toolkit to throw at these disease processes and try and understand immune correlates and what on earth to do about them. So that's what we do and what we're doing at the moment. But if I try and sort of lock into some of the things that have been said this afternoon, I can't begin to overestimate the impact that public involvement has had in our agenda. What we've been through with this in the last couple of years has been completely unprecedented and unlike anything that my lab has ever done before, for all of the obvious reasons that we've discussed. Because if I look at what's happened in our team before, and generations of students that I've taught, the thing you're always trying to show them is that there are many black boxes out there, many unknowns in the medical textbooks, and your challenge is to find a really important one and design some really good studies to illuminate it, then explain it to people, and then stop. And here was something where, well, we didn't even have the black box, did we? We had to have sufferers to point out the black box to us. And that had never happened to me before, or anybody else that I know. So if you like, the public involvement has been it hasn't been something, where we've let people in as a favor. They've let us in as a favor, and they have led the way all the way. And that's, in terms of inputs to our program, really from the word go and more widely through at meetings and in social media. And I think, they've done all of the, or you've done all of the heavy lifting in trying to work out, what is the new pathology. So, I wouldn't have my grant application and my award unless somebody had told me what to look at and what on earth was going on. And that was an agenda that wasn't put in place by hospital consultants or professors or GPs. It was put in place by the hard graft and heavy lifting of some really articulate and motivated sufferers. And so many of those people, I've come to regard them as colleagues and as part of our, like on Brendan's project, part of our expert advisory group, but more widely, totally engaged in our study and our study design. And the only point maybe I'd bring up as sort of detail, and it partly out of some of the things I saw in the chat, including a comment that Claire made, I do think we're at a difficult point at the moment in our family, like all families, where we may necessarily not exactly have a family rift, but have differences of opinion, because people are getting very impatient and very anxious and very angry, and quite rightly want treatments. And medical research is very conservative and very slow. And we're engaged in all those kind of family disputes that, that we're all articulating a lot at the moment. about, do we go with our hunches? Do we go with the treatment we heard about? Do we self-administer a treatment and go down the DIY route if the NHS can't help us? Or do we stay with the conservative, stuffy professors and wait for some really big, really expensive randomized controlled trials, like a kind of recovery trial for long COVID? And you'll maybe guess from where I come from at Imperial College that I don't want things to be slow, but I'm nearer to sort of believing in the value of not sort of inflating your hopes and wasting your time and money and resource and energy on kind of little look-see efforts, but trying to find ways to accelerate doing the job properly. So, but that's a sort of maybe a minor family rift where we've got to use the rift to kind of work together productively. And just like in COVID, the received wisdom had always been that it took 10 years to bring up, and many, tens or hundreds of billions of dollars to bring a vaccine to licensure. When needs must in time of COVID, we showed that you can bring 24 into the world in the space of 9 or 10 months. So all I can say to that is let's try and do the same for long COVID therapeutics, and try and accelerate that kind of stuffy, bogged down process in the same way. And, we know about many efforts going on, including the Stimulate ICP trial and others. So to me, the change, couldn't be more striking. In my sort of fairly long career, I've gone sort of through the curve from no PPI to quite a long period of, reluctant box ticking PPI. When I say reluctant, it wasn't just cynical know-it-all researchers. It was a kind of game of cat and mouse on both sides. So, I can certainly remember diseases I've worked on where, for example, I was very motivated to study a subset of multiple sclerosis patients. I knew that to get the funding, I was sort of honor bound and duty bound to seek out patients from that group and consult them. And they were busy having multiple sclerosis and didn't really care about my research. And I was chasing after them and they were running away from me. And it was a very strange way to do PPI. So I think where we are at the moment and this relationship we have between long COVID sufferers and researchers is absolutely brilliant. And I know it doesn't feel productive at the moment and like we're all delivering together, but believe me, it's I think it kind of absolutely leads the way now in the world of medicine, even compared to past exemplars where people thought they were pretty smart, say like the cystic fibrosis community or the asthma community, where certainly there was a very strong voice for sufferers and their families. The long COVID dialogue has been a million miles ahead of that in terms of really getting things on the table and setting out an agenda. So I suppose for me, it's just a matter of perhaps trying to end on a small note of optimism that I think we have worked together really, really well. And I think that will make good things happen, soonish. I'll leave it there.